Shubhranshu, for those kind words and having me in your IC. And I'm sorry to jump the queue and disrupt the flow, but as he told you, I have another course to attend. That's the reason. So I'll take you through experience counts, writing a review article, and meta-analysis. At the start, I'd like to tell you that research is creating new knowledge, and we have the editor IGO here, and I think he's taken IGO to a completely different level. I can assure you of that, because we've had numerous articles published in the last 3 years that he has been in the IGO, and it has really been absolutely satisfying experience. And he's really streamlined everything with us reviewers, towing the line of sending things on time. And that's actually what gives the writer or the researcher the impetus to basically publish your work. And thank you very much, Dr. Santosh, for taking IGO to that level. Okay, with that, we move on to the hierarchy of research designs and levels of scientific evidence. So if you look at that, basically, it's a huge pyramid that you have out there. But what we are bothered out here is that basically the primary studies that we do, and then the secondary studies, followed by, there is no pointer here, okay. And finally, when you plan on your primary studies, basically you need to plan on the design. If you have no design, you will not be able to do a study. And that is the starting point. Then I'll move on to literature reviews, under which comes the systemic reviews and the meta-analyses. So a review article, what actually is a review article? Literature review is a survey of previously published research, people who have done research on your topic before you, and that is where actually you can find where you're leading your topic to. So that is a very, very important part of writing an article. So the objective to provide critical evaluation, a new potential research areas that you can actually explore, draw new conclusions, and the other considerations could be provide a comprehensive foundation on a topic, explain the current state of knowledge, identify the gaps which are existing in the potential research, and highlight the main methodologies and the research technologies. So there's this PRISMA statement of 27-item checklist for a review article that you have, starting from the title, goes down to the summary, the introduction, and finally the method. Under the method, you have the protocol and registration, eligibility criteria, sources of information, survey, study selection, data collection, data items, risk of bias in the individual studies, summary measures, synthesis of outcomes, risks of basis across studies, biases across studies, and additional analyses. So these actually look a huge long list, but actually when you go through them and do your research article or your review article, it's not really that difficult. Then in the results, you have the study selection, the study characteristics, the risks of bias within the study, results of individual studies, synthesis of results, risk of bias again across the studies, and the additional analysis that you can actually give. In the discussion, you have the summary of the evidence that is very important, which you need to actually adhere to. Limitations, where are your limitations? You should say that, otherwise the reviewers are going to point it out to you, but it's always best to actually admit your limitations. And the conclusion, of course, should be very precise, and exactly what you're aiming at should be available to the reader in those couple of lines or 3 lines that you have. Funding. Funding is a very important part, but that will be dealt by other speakers, so I won't go into it. The structure of a systemic review, again, the introduction, methods, results, and discussion, the normal structure that we follow, that's how it goes into. I'm not going into the details in the interest of time, but just touching almost every steps. So the steps of a systemic review: formulation of researchable questions, select some questions which you are able to answer to, disclosure of studies, evaluation of its quality, and the synthesis. So the review article checklist you have here in front of you. Complete the checklist before you submit your review article. Have you checked the journal's aim and scope? Are you satisfied with that journal where you're sending it to? Because mind you, never send it to 2 journals together. Always wait for one journal to not accept your work and then go into the next. Have you defined the scope of your article? Did you use multiple research search engines to find all that has been written about your topic by others? Have you written a descriptive title and abstract using keywords? When people type one particular word, your article should be able to be traced. Did you start with an overview of the topic? Have you presented a critical discussion? Have you included future suggestions for research in your conclusion? Have you asked a friend to do a spell check and a grammar check? Mind you, that is very important, because very often when we review an article, we send it back because half the article is in past tense and half is in future or present tense. So that is very important. English is important here. And plagiarism, of course, you have to go through it. But nowadays, you have various plagiarism checks which are available on the net free of cost. You can download one of those and actually get your plagiarism check done. So to summarize, should be a balanced discussion and evaluation of the strengths. If your critic is more positive than negative, then present the negative points first and then the positives last. And if your critic is more negative than positive, then it should be obviously vice versa. So then we move on to meta-analysis. Meta-analysis refers to the analysis of analyses. The history I wouldn't go into, you can read it up actually. So meta-analysis, as you see out there, is a statistical procedure for the synthesis of the results of several independent studies. Studies must be combinable. So meta-analysis is an observational study of the evidence and can be performed when there are multiple scientific studies addressing the same question, with each individual study reporting measurements that are expected to have some degree of error. So that's again the pyramid that you have out there, meta-analysis right at the top, evidence-based research that is. And you have the Potsdam International Consultation on Meta-Analysis, where systemic reviews or overviews, I would say rather, the application of scientific strategies that limit bias to the systemic assembly, critical appraisal and synthesis of all relevant studies on the specific topic. Then meta-analysis or the quantitative review, a systemic review that employs statistical methods to combine and summarize the results of several studies. Here I have a table of systemic review versus meta-analysis. So identify and the relevant research studies, identify relevant research studies using a defined protocol, the difference between the two. Discuss factors that may explain heterogeneity, statistically test study heterogeneity, and investigate explanatory variables. Synthesize the knowledge, statistically summarize results to obtain an overall estimation of the treatment effects. Not to systemic review necessarily include not all of them include meta-analysis, but all meta-analyses are based on systemic review of literature. That should be very clear. So the basic steps involved in meta-analysis, you have the specific objective, then you have the specific inclusion and exclusion criteria, literature search, that's a quantity assessment and a data collection, followed by sensitivity analysis to testing for bias, and then the analysis of outcome data. And finally, you have the conclusion and recommendations. So application of meta-analysis, that is investigation of adverse effects, new indications for existing therapies, differential effects among subgroups of patients, selection from among several alternative therapies, and shortening the time between a medical research finding and a clinical implementation of new drugs. So summary of the principles, again, meta-analysis should be as carefully planned with a detailed written protocol in advance, a prior eligibility criteria for inclusion of a thorough research for such studies, make high-quality meta-analyses. The graphical display of results from individual studies on a common scale is an important intermediate step, allowing examination of degree of heterogeneity between studies. Different statistical methods exist for combining the data, but there is no single correct method, remember that. But try to choose the most relevant statistical method to your type of analysis. That is what is important. A thorough sensitivity analysis is essential to assess the robustness of a combined estimates of different assumptions and inclusion criteria. The standard outcome measures, this I wouldn't go into detail because I have already explained to you basically what it is. Statistical methods for calculating an overall effect. The last step consists in calculating the overall effect of combining the data, and a simple arithmetic average of the results from all the trials would be giving you misleading results. Remember, please follow the formulas and the protocols which are applicable to your kind of study. A normal arithmetic would not do out there, and that is it basically. So two types of models are used. One is the fixed effect model and the random effect model. The fixed effect model actually provides a weighted average of the series of study estimates, and the random effect is basically a random effect model. We assume that two components of variation, sampling variation, random variation, And our goal in the analysis will be to estimate the mean and the variance of the underlying population of effect studies. Advantages of meta-analysis, I wouldn't go through the details, I've already explained to you. And limitations of meta-analysis also I have told you. But remember this, that poor designs are also mixed with good ones, which can actually screw up your statistical results. So be careful to leave out the poor designs when you're doing a statistical analysis. Otherwise, that could actually lead you to a not so correct statistical analysis. Badly conducted meta-analysis can always be avoided if the basic principles are adhered to. And again, this is the Cochrane collaboration where you can check all the studies that you've taken in your meta-analysis and find out how relevant or irrelevant they are. So the steps for reviews and meta-analysis: define clearly the questions, search for reliable studies, select the quality by means of clear inclusion-exclusion criteria, extract data from each study and display them clearly, evaluate heterogeneity amongst the studies, calculate the studies of each study, estimating diagnostic accuracy, assess the effect of variation in study validity on the estimates of diagnostic accuracy, interpret the result, assessing how much of the review and meta-analysis can be generalized according to the patient's characteristics. So that's just to show you in a single slide that systemic reviews actually include meta-analyses, but not all meta-analysis could be in systemic reviews. So tips to summarize is one should be careful of meta-analyses that do not opt for a clear or systemic procedure. While creating a systemic review, label or title, one should concentrate on the question that you want to answer. Define and mention your analysis plans well before you begin. And I'll leave you with the thought that your point of view actually creates your reality. So publish your work to immortalize not only your work, but yourself as well. Thank you very much for your attention.
Thank you, ma'am, for taking us so lucidly through such a difficult topic. Since ma'am will be leaving, anyone has any questions, then sir wants to ask.
Award of IGO this time was won by one of those articles which actually did a study from across India and found out that what it is. But again, as I said, that when you do a meta-analysis, you cannot really take each and every study, because then that will actually screw up your statistical results. So basically, I would do that way, that I would read the statistical results, go on to the conclusion and the methods that they have used, and then try to see if one actually relates to the other, and then I would choose those reviews which actually relate to each other and which are more relevant for the present thing. Yeah, because something, say if you're doing a study with say 30 people and you're doing a study with 300 people, so the two would have absolutely different results because of the bias that was exist because of the number that you have. So yes, okay. So Cochrane is very reliable, actually, very reliable. Yes. Yes. Yeah. 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 So like I'll give a small example of say. Absolutely. Like I'll give you a very small example is that during COVID, say most of the North Indian, I think hospitals saw mucormycosis. So if we concentrated our data of COVID on the North Indian hospitals, then mucormycosis would really come up as one of the main complications of COVID, but that was not so in South India or East India or West India for that matter. So yes, you have to include to keep the balance basically. Yes, absolutely.